Next topic is prevention, control, elimination, eradication and extinction. First we'll discuss the meaning of these words and the key point related with the MCQs. So first is the prevention. In all these terminology we'll discuss with the epidemiological triad, that is host, agent and environment. So first is the prevention. In case of prevention, disease is not present. Disease is not present. Here in case of control, disease is present. So first we'll see prevention. Disease is not present. Meaning of this disease is not present means this is the first step or first line of defense in preventing the disease entry into an area, herd or an individual. So the entry of the agent into the host, that is individual, so we are preventing the entry. It means the disease causing agent is not entering into the individual or herd, so we are preventing this. So prevention is the first line of defense against introduction of any disease causing organism. So the definition of the prevention is all the measures taken to exclude a disease from healthy or unaffected populations. So these are the following measures which we take to exclude a disease from the healthy population. So what are the measures? First is quarantine. Second is immunization, chemoprophylaxis and environmental hygiene. Next, education of the people or owner or farmers. Next is early diagnosis. So with the help of these measures, we can exclude a disease from the healthy population. And this is the prevention, that is disease, we are preventing a disease into individual or a herd or a geographical area. Then control. This arrow indicate T means transmission. Transmission means entry of the agent into the host. That is the meaning of transmission. So these three terminologies, control, elimination and eradication. So there is involvement of the term T, that is transmission. So in case of control, agent is there, host is there and transmission is there. So agent is present, host is present and the transmission is also present. Means agent is entering into host, that is causing disease. So agent is present, transmission is present, which is causing the disease to be present. So what is a control? What is the aim of the control? To reduce the morbidity and mortality, to reduce the incidence, that is new cases of a disease, to reduce the duration of disease and to reduce the effects of the disease, as well as to reduce the disease to a non-significant level. So in this case, suppose there are 100 new cases. So the aim of the control is to reduce this incidence or new cases from 100 to 10. Elimination. Again, agent is present, host is present, but this T, transmission, is interrupted. So we can cancel the T. Means there is the interruption of the transmission. And similar to this control, the aim of this elimination is to reduce the incidence of disease. Here also we reduce the incidence of disease, here also to reduce the incidence of disease, but this reduction is below the level achieved by the control. Means in case of control, we try to reduce the incidence from 100 to 10, but this reduction is below this control, means below 10. Incidence here below the level achieved here was 10, but in case of elimination this is less than 10. So in case of elimination, either cases, very few cases are present or cases are absent. So this is one more advanced level of the control, this elimination. Here we try to reduce the number of new cases from 100 to 10, and in elimination we trying to reduce the incidence less than 10. That may be 2, 3, 4 or 5. So the difference between control and elimination is, here transmission is interrupted. Transmission is interrupted. And in both the cases, incidence, there is reduction of incidence, but in elimination there is more reduction, means from 100 to 10, here less than 10. Next is eradication. In case of eradication, this transmission we already interrupted in case of elimination, so there is no transmission, that is interruption of transmission. Number 2, there is extermination of the agent. So in case of eradication, agent is also exterminated, means it is absent, and transmission is also interrupted. So both steps, that is interruption of transmission, extermination of the agent, that is your eradication. So up to the elimination, we reduced the incidence or new cases up to very few or 1 or 2 cases, means new cases we stopped here. In case of eradication, if new cases are not coming, that will lead to reduction of the prevalence. Prevalence means total number of cases. So aim of the reduction is to reduce the prevalence of the disease to the level achieved by elimination. So what level achieved here? Less than 10 or very few. So because of the reduction of the incidence, there is further reduction in the prevalence, that is total number of cases. So here the prevalence reduced to that level which is achieved by the elimination. So, means there is no transmission and there is no agent. Next term is extinction. In this case, agent is no longer exist in the nature or even in the laboratory. So total eradication or extinction of the agent on the earth. So again, the prevention, there is no disease, healthy population, and we are trying to prevent the disease. In case of control, disease is present, but we are trying to reduce that disease to a non-significant level so that this disease will not cause any morbidity and further mortality. So because of the reduction of this to non-significant level, what we are giving, we are trying to reduce the morbidity and mortality and reduction of incidence of the disease. In case of elimination, there is no transmission, interruption of the transmission, but still the agent is present in the environment. And here we are reducing again the incidence but below the level of the control, that is less than 10. Elimination is a regional term and eradication is a global term. For example, rinderpest eradication. So rinderpest eradication date is a very important MCQ, that is 25th May 2011. And in case of eradication, the termination is interrupted and agent is also not there. And extinction means the agent is no longer exist in nature or even in the laboratory. So with respect to control and elimination, the term used is incidence. In case of eradication, the term used is prevalence. But in case of prevention, there is no disease. Levels of prevention. There are 4 levels of prevention: primordial, primary, secondary and tertiary. These are the risk factor, disease, complications, disability or death, aim of the prevention, then mode of intervention, stage or phase of the disease. First is primordial level of prevention. In case of primordial level, risk factor is absent. Because of that, there is no disease, no complication. No complication means no disability or no death. So the aim of this primordial prevention is to prevent the emergence of the risk factor. So we want to stop the emergence of this point, risk factor. So this is the prevention of emergence of risk factor. This is the aim. So risk factor, for example, in case of FMD, we can stop the emergence of the risk factors with the help of FMD awareness camp and animal health camp, where we educate the farmers about the FMD through the awareness camp. So stage of disease, because there is no disease, so we cannot classify this as a stage of disease. So everything is absent here. Number 2, primary level of prevention. In case of primary level of prevention, risk factor is present, but disease is not present. So our aim is to circle this one. Means our aim is to prevent the emergence of the disease. So to prevent emergence of disease means to reduce the incidence of the disease, means to reduce the new cases of the disease. Then how to reduce these new cases? With the help of interventions like promoting the health and some specific protections like vaccination, immunization. For example, FMD vaccination, that is twice a year, biannual vaccination. Then quarantine. And this primary prevention comes under the stage of which stage of disease? Pre-disease stage. Why pre-disease? Because there is no disease. Next is secondary level of prevention. Secondary. Here risk factor is present, disease is present, but complications are not there. So if disease is there, then our aim is to prevent the next step, means to prevent the complications, or we can say to reduce the prevalence by shortening its duration. This is our aim. And how to achieve this aim? With the help of intervention like early diagnosis. For example, tuberculin test, brucellin test and somatic cell count for mastitis. Early diagnosis and prompt treatment. And Here the disease is present, so this is known as early stage of the disease or latent stage of the disease. Where next is tertiary level of prevention. Tertiary level, here risk factor is present, disease is there, and complications are there, and here we want to prevent or reduce the emergence of disability or death. For example, in case of secondary, we tried to reduce the complications with early diagnosis and prompt treatment. So what do you mean by complications? For example, in case of FMD, once the animal recover from the FMD, still there are some post FMD complications, also known as sequel to FMD. These can be remembered by mnemonic PhD and MA. Panting, because of disturbance of impairment of the thermoregulatory centers, panting. Then hypertrichosis, overgrowth of hairs. Diabetes mellitus. M for mastitis, A for anemia. So these are post FMD complications, PhD, MA. So to prevent the emergence of these complications, that is the aim of the secondary level of prevention. In tertiary, disease risk factor is there, disease is there, complication is there, so we want to prevent disability or death of the animal. For example, in case of Mithun in northeast area, maggot wound is the most common complication of FMD in free ranging Mithun, that is present in the interior of forest. So because of this maggot wound, if it is left untreated, then the animal will undergo starvation, no ingestion of feed, and lameness, that ultimately result into disability and death of the animal. So this disability or death we can prevent in tertiary level of prevention. And what is the intervention to prevent this? Rehabilitation, that is restoring the ability to work. Then treatment, therapeutics. So if we treat this maggot wound, then this will not proceed towards the death. So this is the late stage of the disease. So risk factor, disease, complication, disability or death. So in case of primordial, risk factor is not there. So what is the aim? To prevent the emergence of the risk factor. But in case of primary, risk factor is there, so our aim is to prevent the emergence of disease. In secondary, disease is there, then our aim is to prevent the emergence of the complications like post FMD complications. This can be achieved with the help of early diagnosis and the treatment. Then tertiary, risk factor, disease, complication is there. We want to prevent further disability or death of the animal. So these are our aim, and these are the interventions with the help of which we can prevent the emergence of risk factor or disease or complication or death of the animal. And these are the stages of the disease. Disease is not present, so pre-disease stage. Disease is present, but symptoms are also latent stage, early stage, and this is the late stage of the disease. So these were the level of prevention with example of FMD virus. So after levels of prevention, we'll move toward the control. We discussed about control, that there is agent is there, host is there, and transmission is there. In case of control, our aim was to reduce this transmission up to non-significant level so that there is reduction in the incidence, which led to reduction in the morbidity or mortality. So there are two important points related with the control. Host specific agent, they are easy to control. For example, bacterial infection, they are easy to control with antimicrobial therapy. Host non-specific agent means those which have wide host range, vector range, they are difficult to control. Then the government of India is running some disease control program where they are trying to control the disease and ultimately to eradicate the disease. So in sequence, first of all, AI All India coordinated this RP project was there, AI CRP on FMD. It was initiated in 1968. Then FMD control program 2004, National Animal Disease Control Program, which was launched on 11th September 2019. Under this NADCP, FMD and brucellosis control program is there with the help of vaccination, where this FMD is for FMD control in cattle, buffalo, sheep, goat and pig, and brucellosis control in case of 4 to 8 month female calf vaccination program is there. So the aim of this NAD, National Animal Disease Control Program, to eradicate these two diseases, FMD and brucella, and their target is to control FMD by 2025 and to eradicate this disease by 2030. Then livestock health and disease control program, where along with FMD and brucella, there are two more diseases included, PPR, that is goat plague, and CSF in the pig. So these are disease control program with their aim to control and eradicate the disease from India. So target of this NADCP is to control by 2025 and eradicate the FMD by 2030 with the help of vaccination in mass vaccination. Next is eradication. There are three definitions with respect to this term eradication. First, from this epidemiological triad: host, agent and environment. Termination of all transmission. Transmission means that agent enter into the host body. This is the transmission. So termination of the transmission by extermination of agent means if we exterminate this agent, then automatically the transmission will not be there. So that was the definition we discussed in the previous section, that in case of eradication there is extermination of the agent, there is no agent, because of that there is no transmission. So this is first definition. Second is regional extinction of the infectious agent. For example, FMD eradication in United Kingdom. So in this region there is extinction of the agent, that is FMD virus. So this is the definition of eradication, that is regional. The region is United Kingdom, extinction of infectious agent FMD. Then reduction in prevalence, total cases of the disease in a specified area to the point where continued absence of transmission. Absence of transmission means elimination. So the aim of the eradication was to reduce the prevalence to the point achieved up to the level of elimination. Means there is reduction in prevalence to the point of elimination. Example is National Animal Disease Control Program, whose target is to eradicate the FMD by 2030. So these are three definitions related with the eradication. So two diseases are eradicated, one from the livestock and one from the human. One is rinderpest, that is cattle plague, and smallpox, human plague. So rinderpest and smallpox. First Indian report on this rinderpest was given by Helen Commission in 1752. Last case of rinderpest reported from India in October 95 from Tamil Nadu district North Arcot, and last known case of the rinderpest, that is outbreak of the last known rinderpest in 2001. So after this 2001, 10 years active surveillance was there, and ultimately there was eradication of the rinderpest in 2011, 25th May. National Rinderpest Eradication Program was launched on 1st October 1954. Similarly, National Smallpox Eradication Program was launched in 1962 in case of human being. And after this 1954 launch of this National Rinderpest Eradication Program, in 1960, tissue culture rinderpest vaccine was developed by Plorite and Ferris, and this tissue culture, this was the most safest and most widely used vaccine, and this vaccine led to the global eradication of the rinderpest. Then Global Rinderpest Eradication Program, that was launched in 94 by FAO. So because of this rinderpest, some events created in the history. For example, rinderpest led to establishment of first veterinary school in France, Lyon, 1762, and rinderpest led to creation of the organization OIE on 25th January 1924, whose headquarters is at Paris. Similarly, creation of FAO 16 October 1945, whose headquarters is Rome, Italy. So this OIE declared or recognized India as free from rinderpest, and FAO declared global eradication of rinderpest. So these two dates are very important for MCQ point of view, that India became free from rinderpest 2006 and global worldwide eradication 2011, and 25th May is common in both. So 2006, 2011. WHO in case of human, World Health Organization declared smallpox eradication on 8th May 1980, and this was established on 7th April 1948 with headquarters in Geneva, Switzerland. At present, with respect to rinderpest, after eradication, still a program or project is going on where monitoring and surveillance are there. This is NPRSM, National Project on Rinderpest Surveillance and Monitoring. So this was all about the prevention, control, elimination, eradication and extinction with their examples. In next lecture, we'll discuss the approaches for disease prevention and control.